So I'm Dr. Bhavik Panchal. I'll be presenting about use of anti-segment OCT to diagnose occult scleral tear. It's a novel non-invasive technique. So if you look at this, what is common to all these three cases, right? So you have some kind of subconjunctival hemorrhage here, you have post-corneal limbal tear here, and eye with a suspected scleral tear, right? So can we predict which case will you need an intervention in these cases? So all these three cases are cases of occult scleral tear, right? So let's look at the case 1. So 65-year-old male, diminution of vision of 1 week duration, no history of trauma as such from the patient. But if you look at it closely, so B scan does show RD for this patient, right? If you look at it closely, there is a kind of subconjunctival hemorrhage which is resolving, and there is one small dot noted here. Okay, so we went ahead because of suspicion and did a UBM for this patient. It shows that there was a scleral defect with query vitreous incarceration. We went ahead with an anti-segment OCT. To our surprise, we saw that there was a full thickness defect in the sclera, and you can actually see the vitreous which is getting incarcerated into this. Right. So one of the sections clearly showing the vitreous are getting attached to the scleral tear. Again, the conjunctiva had grown over this, so there was no flap which was noted here. Coming to case number 2, so this patient post blast injury 2 days prior had presented with hyphema and a lot of anti-segment inflammation. Okay, if you look at all the segments here, the superior segment or superior quadrant showed a conjunctival tear. Now being a child, you have to give a GA to evaluate this child, so we are looking at a non-invasive technique through the conjunctival laceration if we have a tear or not. So what we found that not just a conjunctival tear is present here, there was a full thickness scleral tear which was noted as well, and this child also had a foreign body because of the blast injury which was seen on the B scan. Coming to case number 3, this is post surgery for a limbal tear repair, and because of a previous experience we went ahead with the anti-segment OCT, and to our surprise we had an foreign body which was embedded underneath the sclera. You can see the fantastic back shadowing post foreign body here, a metallic foreign body. So we have a total of 6 cases where there was good correlation between the anti-segment OCT, UBM, and also the intraoperative finding. Based on our evidence what we noted, we also correlated with the surgical notes which the surgeon had performed. So to conclude, AIOCMTC2 is an important non-invasive diagnostic modality to diagnose occult scleral tears. It gave a confirmatory diagnosis of occult scleral tear which could have been easily missed, especially in the first case and the third case, the foreign body. It increases the predictive value in diagnosing occult scleral tear. Limitation, it cannot diagnose occult scleral tears which are posterior to the maybe beyond the insertion of the muscles. So though surgical exploration remains the confirmatory diagnosis, AIOCMTC2 can be an important non-invasive diagnostic modality, especially in children, to confirm the diagnosis of an occult scleral tear, and rate of surgical exploration can be reduced significantly with such a simple non-invasive technique. Thank you so much.
In first case, you said
Yes.
there is no history of injury.
That is, the patient did not give any history of
So
injury.
any other cause?
No, there was a history of injury. Maybe the patient did not notice. That was because on finding out that we had a RD with CD, that was on the B scan, we were trying to look out why the RD with CD had happened, and we found this scleral tear along with the vitreous incarceration. It was a long-standing, maybe a month-old.
In third case, you
Yes.
said foreign body is there and
Correct.
sclera is intact in that.
No, it was underneath the sclera. So based on the AIOCMTC2,
Underneath the sclera, you said conjunctiva.
conjunctiva was intact. It was underneath the sclera. So we just had to open up the sclera anteriorly, and we found the foreign body sitting there.
Good.
Yes, sure. ओपन करना है, ओपन चाहिए. So this was not suspected, the foreign body here. So it is not through the area of pigmentation. It was somewhere here that we found that This is the foreign body sitting right underneath the conjunctiva, and the sclera. So I can tell you because I only operated this case. There was a thin layer. It can be a fibrous capsule also, which was noted, but it was just anterior itself. Thank you so much for all the questions. Yes.
You like to have do any post CDs test? Third case, simple before you go for an OCT and
Yes.
OCT
So
and ABM.
a serial test will help us if there is any fluid which is coming out of it.
No, I'm talking about the post serial test.
Correct.
Post means occult serial
Scleral
tears
tear, yeah.
which were not being seen. So we
Correct.
can
It
apply a little pressure over the.
It may help us, but if it's already blocked by the vitreous, the found vitreous, the fluid is not going to come out from that. It may not be always a sensitive, 100%
Of course,
sensitive.
I agree.
Yes.
But, before
It
going
can,
for a
surely, it is
post-
also non-invasive
Yes,
test, we
yes,
can do it.
recommended.
Surely, sir.
Yes.
Thank you, sir.